Could changing the color of a plate actually help your loved one living with Alzheimer's disease or related dementia to eat better? Well, the science behind this might actually surprise you. In this video, you're going to learn about 6 changes related to vision that impact a person's ability to eat independently, and I'm going to give you practical strategies for how to manage each one of them. I'm also really excited to share with you that I've just developed a course called Alzheimer's Disease, Managing Meals and Eating Challenges, which is a guide for caregivers. And in that course, I cover issues related to all the sensory changes that can happen in moderate to late stage dementia and more. You can find the course at MelissaBPhD.com/courses. Welcome back to all my subscribers, and particularly my YouTube and HYSU members. We've built an amazing community over the past 4 years of the podcast. And if you'd like to join me for future podcast recordings, stay tuned to the end of this video to find out how you can join me for those weekly live sessions. If you're new to this channel and to the podcast, welcome to This Is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. MelissaBPhD, and I'm a nurse and a nurse practitioner with nearly 30 years of experience caring for older adults and their families. I've been in nursing education since 2005, and when I started my PhD in 2007, I needed a topic that I would be interested in doing research on for the rest of my career. So I decided that I love to take care of older adults with dementia, and I really love to eat. So the reason I wanted to focus on this topic today is because I wanted to share how Alzheimer's disease and related dementias actually change how a person sees things. This is just one of the sensory changes that happen with this disease, but all of the senses are changed as dementia progresses. So this video is only focused on vision, but if you want to learn more, you can check out the course on managing meals and eating challenges, and I'll tell you more about what's included at the end of this video. So before we get into it, if you are struggling with helping a person living with dementia to eat more food right now, what is your biggest challenge? Just leave me a comment in the comments below, and I will get you an answer. So now let's dive into today's video focused on dementia care and how changes in vision impact eating. The neuropathological changes caused by dementia can actually lead to a variety of vision-related changes that not only affect how a person perceives their surroundings, but also has a major impact on their ability to feed themselves and to eat independently. Now, when I say the term neuropathological changes, what I'm talking about is really just the physical changes that happen in the brain due to this disease or to another injury. So these changes can include damage to the brain cells. It can be a buildup of abnormal proteins and loss of the connections between cells, which all impact how the brain functions. Now, in conditions like Alzheimer's disease or other dementias, these changes lead to memory loss, confusion, and difficulty with everyday tasks. But essentially, neuropathological changes are just the underlying brain damage that causes symptoms in neurological diseases. So the changes in vision aren't really due to a problem with the eyes, but it just stems from the brain's reduced ability to process visual information. So the first 2 that we're going to go over, I think, actually are the most critical, but all of them actually impact the person's ability to eat independently. So the first is peripheral vision loss. And peripheral vision loss makes it really difficult for people with dementia to notice food, utensils, or even that other people are at the table with them. Dementia can cause a person to lose peripheral vision, which makes it hard for them to notice anything that's outside of their direct line of sight. And actually, by the time you're 65, you lose about 15% of your peripheral vision just with normal aging. But with dementia, you basically move from having what I call scuba vision down to binocular vision. And this is what I actually call your dementia eyeballs. But if you do this, you will see exactly how much visual field is lost. You can really only see what's directly in front of you. And eventually, these dementia eyeballs or the binocular vision turns into monocular vision. So they really are just going to have a hard time seeing anything, and that's even if they have their glasses on. So they may overlook food items on a large plate, or they may have trouble finding their utensils, which can really slow down eating or lead them to miss part of the meal altogether. So if you were to put your dementia eyeballs back on, I'm going to show you how this actually impacts where you place food and things you might need to think about. So if you do this, and if there was a plate right in front of you, you're not going to be able to see it because it's not normal for us to look down like that. We're just going to be looking out there. So this is often why people with dementia will reach across the table, eat somebody else's food. And the best thing that you can do in that situation is just move the other person to a different spot on the table and just put the person's food out there where they're reaching. Instead of getting upset with them and saying, your food's right there in front of you. Just move the other person's plate, put them someplace else, and put the plate out where the person can see it. So some other strategies include simplifying the table setup. So keep clutter off of the table and make sure that you only have essential things on the table and within that person's direct line of sight. You can use verbal and visual cues. So you can, let them know that where things are located, like here's your glass of water, and then making sure again that you're moving it out to where they can see it. You can also use a sensory motor cue. What I mean by these are hand feeding techniques. So the ability to feed yourself is the first thing you master in childhood. It's the last thing that you lose with Alzheimer's disease. So this movement of moving food from the plate to our mouth or from wherever it is, that is a sensory motor movement that we have always associated with eating. So you can use overhand, underhand, or direct hand to further optimize cues. So in addition to giving verbal and visual cues, we use the hand feeding techniques to give them a sensory motor cue. You also want to keep your hand on their shoulder when you're assisting them. And that's just to let them know that you're there. You can learn more about the hand feeding techniques in the course I've been mentioning. It's called Alzheimer's Disease, Managing Meals and Eating Challenges, a guide for caregivers. And you can find the course at MelissaBPhD.com/courses. And I'm also going to include the link below in the description of this episode. And then the last thing we can do is to adjust our seating arrangement. And be sure that you sit on the dominant side of the person when you're helping them to eat. Because again, you're trying to tap into a movement that they've associated with eating their entire lives. And so if you're sitting over on the side with them on their dominant side, it's just easier for you to help them do that. So the second change is depth perception. So changes with depth perception actually make it hard for them to judge distances. So, if they're trying to pick up a glass or see where the food is on the plate, they might misjudge how far away or how close things are, because a lot of people with, moderate to advanced dementia, they just don't have depth perception anymore. So this could lead to them spilling things, missing a bite of food, or not being able to pick up the food or their utensils accurately. So some strategies that we want to do for this one, we can use contrasting tableware, which means using brightly colored plates and cups that stand out from the table surface. So if you have a white tablecloth, you don't want to give them a white plate and a white cup because there's no contrast. It's all just going to kind of blend in together. Way to fix that, you could put down a black placemat and then put the white plate there. But you just have to have some type of contrast. So when we're setting things up, be sure that you look at it through the eyes of the person with dementia, so that you can decide if there's enough contrast for them to see it. So the second tip would be to avoid transparent items. So replacing clear drinking glasses with solid colored ones that are different from, again, like the table below. And then the third thing is you can guide them with touch or demonstration. So again, this goes back to the hand feeding techniques, deciding if overhand, underhand, or direct hand is going to be the best way to help them. And then just kind of gently guide their hand to the utensil or demonstrate how to reach for each object. Because one of the other things that is preserved with Alzheimer's disease is this ability to mirror our motions or movements. So if you're getting value from this video, please share it with someone else who could benefit from this information, because that just helps the podcast, and I'm sure they would appreciate it. So the third thing is color and contrast sensitivity, which we talked a little bit about in the depth perception category, but reduced sensitivity to color and contrast is also common, which makes it difficult for people, again, to distinguish between similarly colored items. So you don't want to put white mashed potatoes on a white plate, because that reduced ability to distinguish between colors and having very low contrast, or when everything's the same color, it's hard for them to see the food and the utensils as well. So again, strategies for this are to brighten the environment. So make sure that everything in the dining area is well lit so that they can see everything. Again, we want to choose high contrast tableware. So using plates that contrast sharply with the food. So if you have white rice, maybe put it on a red plate or a blue plate. Blue plates are actually known to actually increase people's appetite. So if you're eating off food plates and you're gaining weight, that might be why. But in this situation, with a person with advanced Alzheimer's disease, they can have the blue plate. You also want to be sure that you avoid patterned surfaces. So just use a plain tablecloth and then dishes that are a different color so that they don't get confused. The fourth thing is motion detection. So some people with dementia actually have trouble detecting motion, which can make it difficult for them to see the movement of utensils or even track their own hand motions as they're eating. So difficulties detecting or understanding movement really make it harder for them to follow someone else's hand movements or to track items as they're being placed around a table. So this can lead to them being disoriented or cause them to miss their mouth with a fork or a spoon. So strategies for this one, just being sure that you're moving slow and deliberately. So making slow, clear movements when serving food or helping them with their utensils. You can give them very clear instructions. So describe the actions before you're doing them, such as I'm going to place your cup next to your plate now. Another thing to keep in mind is, in the US, we typically keep our plate in the middle and the glass is up in the right upper corner and utensils are typically on each side. So if the person isn't putting those things back in the right place, then just move them back, because even they're not going to remember where they put it. But if you just put it back in the right place, then it's going to be a lot easier for them to find. And then the last thing for this one is just to keep the dining environment calm. So just trying to minimize sudden movements or distractions around the table. So for this one, it's just making sure there's not a lot of traffic. So make sure people aren't coming and going in the dining room as much as possible. So again, just wanted to remind you, if you're struggling to help a person with dementia right now to eat more, what is your biggest challenge? Don't forget you can either ask a question or you can leave a comment in the comment section below. The fifth thing is recognizing faces and objects. With some types of dementia like Alzheimer's disease, people struggle to recognize familiar objects or even food on their plate. So the person may struggle to identify their fork, or they may not recognize the person who's trying to help them. They may not recognize that a sandwich is something that they can eat, and they may forget the purpose of a fork or a spoon or use it in the wrong way. Picking up a fork or a spoon and trying to brush their teeth with it. But all those types of things just create more confusion and can lead to loss of appetite. So some strategies here, you could label or point items out. So using simple descriptions or labels like "here's your spoon" while showing them the object. But again, part of the issue, if the person has pretty moderate to advanced Alzheimer's disease, is they're going to be losing the ability to understand language, and they may not be able to read as well. So again, all of these are trial and error. And in the course, we go over a lot of different strategies that you can try for all these different issues. You can also introduce yourself regularly, because even if they know you at the start of the meal, they might not remember who you are before the meal ends. But again, just not rushing them, you're reminding them who you are, and then just trying to be calm yourself. And then the last thing with this category is just to simplify choices. So give them one item at a time. So instead of overwhelming them with multiple options, like having all of their food on one plate at the same time, like we would normally serve somebody now, put it in a smaller bowl or a dish and just give them one item, at the time. And then the last visual change is hallucinations or misinterpretations. So visual hallucinations or misinterpretations can occur. So this might mean the person misidentifies shadows, reflections, or patterns on the table as something that's either distressing or something that they can't eat. Visual hallucinations and misinterpretations of objects also make mealtimes confusing or distressing. So this could result in fear or reluctance to eat. And so we just have to adjust the dining environment for them. So strategies here include, again, staying calm and reassuring. If they see something that isn't there, don't just dismiss their experience, but you can just gently redirect their attention. So whatever it is that they're misinterpreting, You can also just remove it from the environment. Secondly, we want to eliminate visual triggers. So remove objects that are shiny or reflective surfaces, making sure that there are no patterns on the plate or the tablecloth that can be misinterpreted. And sometimes these things can even be just distracting. And then again, adjusting the lighting, because when we have consistent non-glare lighting, that reduces shadows or distortions that could actually contribute to the misinterpretation. If the person wears glasses, be sure that they have them on, because even though these visual changes aren't related so much to like their visual ability, it does help people to recognize shadows and interpret them better. So if the person has glasses, make sure that they're on during meals, because all these visual challenges can greatly impact a person's ability to feed themselves, and it can actually reduce their motivation to even eat. And then this could lead to weight loss and other nutritional concerns. So these strategies not only address the specific vision changes, but they can also just create a supportive dining environment. And that helps to reduce frustration and encourage positive mealtime experiences, both for you as the person helping them and as their care partner, but also for the person with dementia. These simple but practical strategies, like using high contrast colors for plates, providing simple, familiar foods, and ensuring a well-lit and uncluttered dining environment, all help are ways that caregivers can help make mealtimes more accessible and more comfortable for people with dementia. So if you found this video helpful, be sure that you hit the like button and subscribe to the channel if you haven't already. And if mealtimes with your loved one are feeling more like a challenge than a way to connect, or if you've ever struggled with behaviors like refusing to use their utensils, wandering, or a sudden disinterest in food, you are not alone. And that's why I'm excited to introduce my online course called Alzheimer's Disease, Managing Meals and Eating Challenges, a guide for caregivers that's been specifically designed for family and professional caregivers like you. Now, in the course, you learn about the hidden impact of sensory changes on eating. So we talk about how dementia affects the 5 senses, and we talk about practical tips and different ways that you can adapt the meal. You'll learn 3 different hand feeding techniques. So I give you a step-by-step method that brings comfort and dignity with every bite. Thirdly, you will understand and be able to manage mealtime behavioral challenges. So discover why behaviors like wandering or not using their utensils happen, and then how do you respond to that in a way that's helpful for both of you. And then the last thing that we learn is a problem-solving. I teach you a problem-solving strategy. It's called the C3P model, and by using that model, it's just a simple way to help you think through: is it something with the person? Was it something with the people or our caregiver approach? Or is it something about the place or the environment that we need to modify? So this isn't just another caregiving resource. It's a practical guide that's filled with these expert strategies that are all evidence-based. There are video demonstrations and skills checklists that you can start using immediately, as well as an ebook. In fact, if you go to the course and you go to my Teachable School, if you just want to buy the ebook, you can do that too. But hopefully you'll buy the course, and it will help to make your mealtimes easier, more enjoyable, and totally less stressful. So again, just go to MelissaBPhD.com/courses. Look for the course titled Alzheimer's Disease, Managing Meals and Eating Challenges, a guide for caregivers. And thank you so much for joining me today. If you'd like to be part of my community and continue to learn more about aging, age-friendly initiatives, and Alzheimer's disease, don't forget to drop by my website at MelissaBPhD.com and grab your free podcast insider guide. I did about 10 different handouts for prior episodes, and by becoming a podcast insider, you get all of those combined. You can also join the podcast private community on Facebook, and that'll be in the email once you become an insider, because all podcast insiders are actually invited by email each week to join me for the live podcast recordings in the Facebook group and by Zoom. So I hope you'll stop by to grab your free guide, and then keep an eye on your inbox weekly for those special insider-only invitations. And again, if you found value in this episode, please hit the like button and share it with someone else that will find it helpful. Hit the subscribe button if you haven't, and turn on your notifications so that you are alerted when the next episode comes out, which is every Tuesday at 11 a.m. Eastern Time. And until next time, be well.